So welcome back, everyone. We want you to know that this is a very, very safe place. Please don't forget that. Everyone has opinions, and it's really important to be respectful to what everyone is thinking and saying, because we all come from different walks of life. Again, lots of information that Leslie and I are going to be presenting, and we don't expect you to remember everything. You all should have received the slides and the recording from last night, or excuse me, you should have received it last night from the presentation that we had on Monday. You're not going to remember everything. It's okay. We want you to ask questions. If you can, please wait until the presentation is finished. And if you feel uncomfortable asking a question, please write it in the chat box. Y'all were very quiet on Monday. There were no questions. We were surprised. So just know that we are open and you can ask us anything. If you speak Spanish, you can private message one of the interpreters or Christina Zavala. So if you happen to log off and then need to be logged back on again, sometimes people forget to mute themselves. So please make sure that you do. And if not, we will go ahead and do that for you. We should be finished by about 1 o'clock. It just depends on if there are any questions, and we might finish a little bit later. And again, I will send you the slides and the recording either by tonight or tomorrow so that you have it in time for Friday. And then for the lady who, for Cindy, I'll make sure that I send you both slides and both sets of recordings. So there's lots of things to remember when you are in what we call those ARD IEP meetings. So just a little bit of a refresher. The ARD stands for Admission, Review, Dismissal. And the IEP is Individualized Education Plan. So Leslie and I could probably talk for 3 hours, but I don't want to talk for 3 hours. Leslie doesn't want to talk for 3 hours, and we know y'all don't want to listen to us for 3 hours. So what we've tried to do is gather the most important top tips so that you can have successful meetings. We talked about it on Monday. It's really important for parents on this call to remember that you know your child better than anyone else. And you have many rights as that parent in this special education process. But you have to know what your rights are because you don't know what you don't know. You must learn your rights if you want your child to receive what we call FAPE. FAPE is free and appropriate education. And to the ECI coordinators on this call, we're so happy that you have joined us. Please know that your opinion matters as well. If you are in an ARD meeting with the school district, with the zoned elementary school, and there's something that you want to bring up, it's important that you do that. Why? Because it's not about us versus them. It's about what is in the best interest of the child. And you've known that child longer than the school district has because you've been working with them. So I encourage ECI coordinators to speak up as well. Please remember that free and appropriate education requires schools to provide special educations that meet the unique needs of a child. I think that sometimes it can be challenging because we, sometimes as parents, we want more than maybe what the school can give us. So sometimes you have to compromise, but you can get, hopefully, with compromise, most of what you are looking for. Nothing is perfect, and that goes for a private school or a public school. So the IDEA manual, we talked about that, and it is in English and Spanish. Everything that we do and what we're discussing is based on IDEA. This is federal law. So this has nothing to do with Texas. If you move to a different state, that school has to follow the law as well. And it stands for the Individuals with Disabilities Education Act. And it makes sure that public schools serve the educational needs of students with disabilities. If you can remember, like, well, you may not remember, but 40, 50 years ago, schools didn't have to accept children with disabilities. They didn't know how to accommodate them. So the Individuals with Disabilities Education Act is really, really important. Could you imagine calling up a school today and saying, my child is 4 years old and has a learning disability? They could say, sorry, we don't know how to help them. That's what happened decades ago. Fortunately, we don't have that anymore. But with the IDEA, you need to read it, learn it, take it with you. The school, if they see that you know what IDEA is, they will accept you as an equal member of that ARD team, because they know that you know your rights. It's not that a school is going to want to try to pull one over on you. It's not like the school is going to try to mislead you, but sometimes even schools don't know all of what is in the IDEA manual. So this can be your chance to educate them as well. You can download this important document, a great website called Disability Rights Texas. And again, it is in both English and Spanish.
And the IDEA manual, I like it so much because it is in very parent-friendly terms, and they have sample letters that you can use to communicate with the school that you can adapt to fit the needs of your child. And I will tell you, mine, I printed it out, I highlighted it, tabbed it, brought it with me. And I feel like when they see that you have that, I would always put it on top, and they know you know your rights. They treat you very differently.
Good point. Thank you, Leslie. So tip number 3, the IEP. Again, that is that individual education plan. So individual meaning for your child. So when my son was in school, his IEP was very different than Leslie's son. But that is the centerpiece of that federal legislation that we call the Disabilities Education Act, or IDEA. So it is so important that the IEP is customized for your child, for your loved one. And we want to make sure that they are getting that free, appropriate public education. And it's going to emphasize special education and related services. We talked a little bit about related services the other day. That could be speech therapy, occupational therapy. It's designed to meet their unique needs and to prepare them for further education, employment, and independent living. So every IEP meeting that you have is building upon the previous one and the previous one, because when your child graduates high school, and they can stay through age 21 up until age 22, that they're prepared. There's nothing more frustrating than spending all of those years in public education with no plan. So you always want to make sure that you have a plan. And that's what the classes that Leslie and Christina and myself are doing, is to help prepare you for that. So that IEP, it's a contract. It's between you and the school. It is your role as a parent to participate in the development of your child's individualized education program or plan. And always understand what you are agreeing to. Because when you have an ARD meeting, parent, that's okay, Leslie, they're going to ask, do you agree or disagree? Well, it's okay to disagree. Or if you don't understand something, make sure you ask them about it. So what should you do before the ARD or IEP meeting? Gather information. I can't tell you, and Leslie, I'm sure you run into the same thing. We have parents who call us at Family to Family Network, and they don't really even understand what their child's disability is. It's important that you understand that. Get draft copies of the evaluations. Make sure you understand a doctor's report, a speech therapist report. Maybe your child is getting ABA therapy. Make sure you understand where they're at. What are their present levels of academic achievement and functional performance? And I know that that's a mouthful. They call it PLAF. That's the abbreviation for it. But you want to make sure that you know where your child is at. Because if you don't know where they're at, how can you help them and guide them on where they should go next? Make sure you know what are the proposed IEP goals and objectives. You should get that information before your ARD meeting. I would usually ask for it 3 to 5 days ahead of time because I want to go through it, ask any questions, highlight any information. And then you also want to gather other information like supplemental materials. Is there a behavior plan? Do you know about the autism supplements? And we discussed that a little bit the other day, and we're going to be going over that again. Are there any vision or hearing supplements that you need to know about? You want to be prepared for the meeting. The more prepared you are, the more seriously the committee will take you. So you want to read through these documents ahead of time and know what people are talking about. You don't want to walk into the ARD meeting and everything be brand new for you. Tip number 5, evaluation. And a couple of you wrote that you were really glad to know about the evaluation process, and we truly appreciate that feedback. But know that all the services that a child needs are based on that initial evaluation. Remember, we talked about an FIE, a full and individual evaluation. So everything starts with that. Parents can say all they want, what may go on in the home, what happens when they're in the community. But it's the evaluation that the committee bases their information on. And other data is collected after that evaluation. Everything runs, excuse me, on a timeline. Make sure you know what the timelines are. We had it on a previous slide. From the other day, from Monday. Make sure you know what your timelines are. There is a timeline for the initial evaluation, but there is no required deadlines for other evaluations or re-evaluations. So if your child needs another evaluation, find out when it's going to be completed and get it documented in the IEP, that individualized education plan. And remember too, that everything needs to be in writing. If somebody verbally told you something, it does not count. Tip number 6, it's meeting time. So if possible, and we know that we all lead very, very busy lives, if possible, please don't go to a meeting alone. You don't need to have an advocate with you. You can if you want to, but you don't need to. But do bring a friend or relative with you. They can be another set of eyes, another set of ears, and they're wonderful for moral support. I'll never forget my first ARD meeting, and there were like, excuse me, 8 people, and then there was me. And I was still okay. I mean, I was comfortable, but it can be really intimidating. So I think, and we think, it's really important to bring someone with you. If that person knows your child, that's even better, but just bring someone with you who knows. Meet with them ahead of time so they know your concerns. and they can ensure that your questions are addressed. Maybe your friend can be in charge of taking notes. Maybe they can help you follow the art agenda, and they can be there to support you during the meeting. And take your child to the meeting, even if it is just to introduce them. If your child is, 4 years old, they can at least be introduced. Let the committee see who your child is. They don't have to stay for the whole time, but you can go around the table, introduce them to people, and then your child can speak. Might as well start now. Let them get involved early. Tell them what they like or don't like about school, and then they can return to class. This can help prepare your child for the day when they are required to attend art meetings, and that starts in high school. And you can have your child there the whole time if you want, but at a minimum, at least have them for a few minutes. Tip number 7. During the meeting, ask questions. If you don't feel comfortable asking questions, you'll never know answers. We realize it's intimidating, but you are an important part of that team, and you need to know what people are talking about. Asking questions is okay, because if you don't understand something, ask what they mean. In this world of raising children and loved ones with disabilities, we use so many abbreviations. I can't remember all of the abbreviations, or they change over time. So make sure you ask questions. Ask for data to support the decisions they want to propose for your child, and ask, how is that data going to be collected? Ask for support if you need it, and ask if others need support. Instead of asking, remember, asking a yes or no question gets you a yes or no answer. So it's really important to ask those open-ended questions. And that can help as well, because it helps to foster conversation. And then people can say, oh, okay, let me elaborate on that. Let me tell you more. But questions like, what will it take to ensure my child is included in the regular education class? What will it take for my child to receive a specific service? It allows the committee to brainstorm for solutions. And that's what you want. But if you wait to ask your questions and then agree to the decisions, that isn't going to work very well for your child. Asking questions isn't a bad thing, it's a good thing.
I was going to say too, Judy, when you ask a question and you get an answer, I like to then have the diagnostician or whoever's taking the minutes of the meeting, I like to look at them and say, if it's something really important, would you please note that in the minutes of the meeting? That way, 2 weeks from now, if they told you somebody was going to do something, or it was going to be a certain amount of time or whatever it is, 2 weeks from now, if they act like they don't know what you're talking about, you can refer to the minutes that Miss Principal said that this person was going to do this or that on this certain day or whatever.
Exactly. I'm so glad you brought that up, Leslie. And when it comes to the services, like say they say, okay, 2 30-minute sessions of speech therapy a week. Ask, is that individual or group? You want that in the ARD minutes, because the only way that anyone is held accountable is if it's in the ARD documents and if it's written. Verbal does not count.
Yeah, that's a really good point, Judy, because I've seen some IEPs where a student gets a 15-minute session of speech therapy in group. What would that even look like? I mean,
Right.
You wouldn't even get around to each kid. The kids probably wouldn't even warm up to the speech therapist in 15 minutes. So it's really important to know all the details.
Yep. Absolutely. So during the school year, and we know you're busy parents, but you know what? We have email. That was something I never grew up with. Shows you how old I am. Email your teachers. Meet and communicate all year with the staff and the professionals that work with your child. The only time you should not be communicating with the ARD committee only at ARD meetings. Keep in touch with them. Make sure you know what's going on. It doesn't have to be every day. I think that would be very challenging for teachers, but maybe every week. Just a quick check-in. How is Johnny doing today? How is Sally, how are her behaviors? How is it going? Yes, ma'am, Christina.
Sorry to interrupt, Judy.
No, please, by all means.
I've been notified that they are not listening to the translation. They can hear it, the interpretation.
Oh, my goodness.
I don't know if something's going on.
Yeah, Myrna and
Ya, no la estábamos oyendo. Por favor, quien esté escuchando en español, diga.
Sí.
Ok, muchas gracias. Gracias, Myrna.
is it working now?
Sorry, thanks.
Christina, is it working now?
No hay problema. Gracias.
Are we okay now?
Okay,
Okay, great.
thank you. Sorry
And
for the
Ruth, I'm
interruption.
so glad you told us because it's really important that you are part of this conversation. So during the school year, you want to work together with your school. Before the ARD meeting, you want to discuss concerns, develop goals, brainstorm, so that everybody is on the same page before the ARD meeting. You can certainly discuss more during the ARD meeting, but make sure that you have an idea, where's your child at? That's really important to keep in touch with the teachers, with the therapists throughout the year. I used to probably every week, every couple of weeks, check in. I didn't want to wait until the grading period, what is it, every 6 weeks, and then find out that my son isn't doing well. I wanted to know beforehand so I could get him the help that he needs. So just make sure that you set up a communication system that works for you and your teacher or teachers. We would love to think that teachers have only our child to focus on, but that isn't being realistic. I love teachers. I applaud them. I think they do an incredible job. I think these last couple of years have been so challenging for them. Teachers are doing the best that they can with the resources that they have. They may not be able to respond to you immediately. If they do call you on the phone and you end up having a verbal conversation with them, that's great. But if they've promised something, make sure that you follow up with an email and say, okay, Miss Teacher or Mr. Teacher, thank you for talking to me. Make sure you get everything in writing and you get responses in writing. So you have to document everything. Verbal conversations are fine, but make sure you follow up with an email and that they respond to that email so that everyone is on the same page. Teachers get inundated with so many emails and they get bombarded. Make sure that yours is acknowledged and answered, because if it's not written down, it may not happen. So we talked the other day, and we're going to go over more on Friday about the procedural safeguards. You want to make sure that you understand what those are, and it has to do with prior written notice. It's on page 2, and it means that what is required when the school proposes or refuses to provide a service. So to the parent who asked this question from Monday about when the school refuses to do something, they need to tell you in writing why they won't do something. Make sure if you speak English, if you speak Spanish, if you speak Vietnamese, make sure it is in your native language or a language that you will understand. So if they're not following something that is in the ARD document, that's different. But if they're saying you're asking for a certain test to be performed and they refuse to do that, they must tell you in writing why they won't do that. So we've listed the Texas Project First website, and it explains all about your rights. Texas Project First is an amazing website, and ECI coordinators, I could encourage you to share this with your parents. It was written by parents for parents, and it explains all about the special education process in both English and Spanish.
I was just going to say a little bit about your procedural safeguards. Of course, you definitely want to read them and understand them, but the basics of it are, if you disagree, you have 3 options. If you disagree and do nothing, the school gets to do what they proposed. So disagreeing and doing nothing is just like agreeing. So if you disagree and you want something else to happen, then you use your procedural safeguards, which is you can file a complaint. You can ask for mediation. A complaint, you put what your complaint is and what you think the remedy to your complaint should be. Or you can file for mediation. All of these go through the Texas Education Agency. Mediation is where an impartial person comes in and they put you in one room and the school in another room, and they go back and forth and try to help you come to an agreement. Or you can file for due process, which is where you would go to hearing. Generally, I will say when you file any one of those 3 things, it usually doesn't get that far, because the Texas Education Agency is going to ask the school to come back and have a resolution meeting with you. And that's usually where things get worked out, because then they know you know your rights and know what to do if you disagree. And one thing for sure, you can go on the Texas Education Agency website and look at the due process hearings, and you're not going to see a whole lot of them. And it's because things generally do get worked out in resolution. So don't be afraid of using your procedural safeguards if you disagree and it's something really important.
I'm glad you brought that up, Leslie. And we're going to go over other options on Friday about when you disagree, who you can call, and who you can discuss that with.
And I know Judy talked a little bit about getting educated, learning about your child's disability and the special education process. You can attend trainings by different parent organizations, just like the ones we're doing today, but there's many organizations out there that do trainings throughout the year, and most of them are free. Sometimes your school district may have trainings through the special education department. And then we also each have an education service center for our region. They do some really good trainings, and parents are always welcome there. Sometimes those trainings they do charge for those trainings sometimes. Also, one thing we didn't mention is conferences. There's a lot of different conferences that go on throughout the year. Family to Family Network has a conference. I believe ours is going to be in March, where we have different speakers come in and you choose what sessions you want to go to and learn more things. And then we also have a big resource fair where you can meet with others. Judy, what would you call them? I don't want to call them vendors, because some of them are nonprofits.
Right. Well, they could be vendors or nonprofits, and they can share more information about your disability or a service that they provide.
Yes, thank you.
Sure.
And then definitely know about the art agenda. Sometimes the schools will have one laminated and on the table for your IEP meeting, or you can go to Texas Project First. We've listed here that kind of helps you know the agenda, because like we talked about yesterday, it should go in an order. They shouldn't be already determining what placement your child's going to be in at the beginning of the meeting. That should be last. So you want to try to keep the committee on the agenda. And usually the art committees are good about doing that. Obtain and use tools that are provided to help you learn about special education. One that we talked about yesterday was the Texas Autism Target Manual that described all the different evaluations, the guide to the art process, the IDEA manual. There's also a dispute resolution handbook that I really like. If you get to the point where you're gonna use your procedural safeguards, that's a good handbook to look at because it goes in a lot of detail. The parent companion is great, especially for people who have young children. And of course, Texas Project First, Navigate Life Texas isn't listed right here, but that's another really good one. All of these are good tools to help you not only learn about the special education process, but about other things available and things that you need to do in the whole in the whole disability community. You do want to try to stay organized. You know, keep your evaluation reports, your IEP goals and objectives, in any other, the autism supplement, progress reports and report cards. If you have a young child, you may not get a regular report card, but you will have IEP report cards that track progress on the IEP goals. Any notes or phone logs. If you talk to somebody, be sure. I kept a little notebook, you know, because if I talk to somebody, I like to know the date and who I talked to and what they said. So you could refer back to that. And we're going to talk more about organization on Friday. Okay, if you disagree, you know, first I want you to know that you can disagree and it's okay to do that, but you have to take the next step if you do disagree. Otherwise, the school's just gonna do what they want to do. I know we talked a little bit about you don't want to be disagreeing about every little thing. We do want to work together with the school. But if it's something important, you know, don't be afraid to disagree, because some great things can happen when you disagree. We talked about if you don't agree with the evaluation, or if you think more evaluation needs to be done, you can ask for that. You can ask for the independent evaluation at the school's expense. Some people also like, if you have good insurance, some people like to get an evaluation separate through their insurance, and that's okay too. And you can bring that information to the art committee. They do have to consider it. If you don't agree with the program or the services, you will be given an opportunity to write down everything that you don't agree with. That can look very different. You can write it out yourself and have them attach it to the ARD document, or a lot of times you can have, you can dictate it and the diagnostician or whoever's taking minutes will put that in the minutes. You always want to read through every page of that IEP document, including the minutes, before you agree or disagree and make any corrections. A lot of times parents will ask questions and say things that are important, and they may answer them or not. And it's not that every little thing's going to be in the minutes, but if it's really important, you do want that documented in the minutes. I like to bring a little note card that says, would you please put that in the minutes? And maybe the person that's with you can remind you of that, just to get everything documented. Another reason that you might not disagree, that you might need to disagree, is if you don't understand what's happening in the ARD meeting. And a lot of times they'll say, okay, we have an hour for this meeting. Well, not really. Maybe they only have an hour that day. So they can, if you're not finished and you have questions and you want to get more information, you can table the ARD. If they don't want to table the ARD, your only other option would be to check disagree, because that's going to throw you into a 10-day recess meeting. So however you want to do it. Don't let them tell you that we only have this much time. Maybe they only have that much time, but then they need to schedule and finish at another time. If you do disagree, it is really important to make sure that your written statement or your reason for disagreement is reflected in the IEP. If there's no statement of your disagreement, the committee may think you're agreeing with them.
And something else I just wanted to add about the independent evaluation. I think somebody, maybe it was even an ECI coordinator, I don't remember, had mentioned to me that they didn't realize about an independent evaluation. So that doesn't mean that parents can go out, get a $2,000 evaluation and send the bill to the school district. It doesn't work that way. You need to tell them that you would like an independent evaluation. And maybe you felt your child, that the evaluation done by the school that day was not really reflective of your child. Maybe your child had a day that was great. That's not usually the case. Or maybe it was the reverse. Maybe they didn't have such a great day and they can do more. Or maybe there were things that the evaluator missed that another diagnostician might pick up on. We don't want to over-test our kids, but having an independent evaluation at the school district expense is a choice that families have.
And there's a lot of good information about that in that IDEA manual. And I really like it because at the end of the section on the evaluation and independent evaluations, there's sample letters that you can customize if you need to request an independent evaluation, because again, you do need to put that request in writing. So we talked a little bit about the 10-day recess meeting or reconvene meeting. And it could be more than 10 days. If you disagree because there's going to be an IEE, it could be longer, but it's something you would decide in the meeting. But it defaults to 10 days if you don't decide anything else. And that's where everybody goes and brings more information to support whatever it is they feel should be happening. You come back to the table and hopefully you get things worked out in that recess meeting, which that does happen a lot of times. And you should be working together and communicating to try to come to some type of agreement. So hopefully that's what will happen. Also, you do have the option to request a state facilitator come to the IEP meeting, and just if it's contentious, a lot of times a facilitator can come in and just kind of keep things on track and keep the meeting focused on the child. But you have to ask for that within 5 days of the disagree ARD. If you still disagree at the 10-day meeting, the school will implement the IEP that they feel is appropriate, unless you take the next step, which would be mediation, complaint, or due process. And one other thing that I wanted to mention about that is if you do disagree and it's about placement, and let's say, for example, if your child is in a placement that you don't want changed, and that's what the disagreement is about, you have to file due process within 5 days in order to invoke what they call stay put, so the child can stay in their current placement until you work everything out. You want to create a vision for your child. And I know that's hard to think about when your child is very young, but the whole purpose of IDEA is just to prepare your child for the future, for life after high school. And so it doesn't have to be anything very elaborate. I would always share my vision at the beginning of the meeting just to remind them and help them understand why I was going to ask for things that I felt were appropriate. And you always do want to use the word appropriate because they don't have to do what's best for your child, but it does have to be appropriate. And I know that's a very subjective term. It's not really defined in the law, but I mean, I think we can all decide what's appropriate for our child. So my vision was pretty much simple. My vision was for my son to grow up and be happy and be living in the community, not be living in the state-supported living center or in a segregated environment, and to be productive, contributing member to the community. And of course, be happy. That was the number. Safe and happy was always, first and foremost. So that kind of helped them understand why we were always wanting him to be included in the regular ed community. The IEP is like a map to get to your destination. So, and it really matters when they're young, because if you start out in a certain way in the beginning, that might not put you onto the road of where you want your child to go. And of course, we can always make changes down the road, but what would you want your child to do if they didn't have a disability? What would your expectations be? And we talked about having really high expectations, but of course being realistic, but nobody has a crystal ball. So I don't think anybody can decide anything for any 5-year-old or 3-year-old or 6-year-old that they're not going to go to college or that they're not going to do this or that. So you definitely want to have high expectations and put them on a path of where you want them to go for life after high school and to go on to college or employment, or in my son's case, down the road, it was not really, college wasn't really going to be an option for him, and not even maybe employment, but I wanted him to be in the community in a good day program, and everything we did along the way led him to do that, to not be at home with me and sitting on the couch and not being part of the community. So it does matter, and it does matter at an early age. So you definitely want to have a clear vision, and your vision can change over the years too. So don't worry about that. You can change it up every year. It's kind of like you wouldn't get in your car and go on vacation without knowing where you were going, or at least having a map. And you have to have a destination in mind for the future. You can talk about your hopes and dreams for your child. What are those? And what are your child's hopes and dreams? Of course, at a very young age, we may not know that. What are they going to do when school's over? What steps does it take to get there? Like a lot of times I'll have parents tell me, oh, my child's going to go to community college, to the vet tech program at Lone Star College when he graduates. Well, what does it take to get into that program? Are you being realistic? And is the school preparing them for that? So all of those decisions in the ARD meeting, contribute to that.
Something else. Oh, I'm sorry.
Go ahead, Judy.
Yeah, something else too is, regardless of your child's disability, or for ECI coordinators on this call, the disability is only one part of the child. Your child can do great things. As Leslie said, the last chapter has not been written, and we don't know how your child is going to progress. But what's important to remember is that your child has hopes and dreams and goals, just like every other child. And you want to try to fulfill those to the extent possible. But try not to get too hung up on the label of your child, whether it be autism or a learning disability. That is just one part of your child. Sure, they might need accommodations and modifications. That's why you have these meetings, to make sure that they're getting the support that they need. But try to let them also be a kid, let them enjoy life, and make sure that they are not only defined by their disability.
Very good, Judy. Okay, Medicaid waivers. Hopefully you all know about Medicaid waiver programs. If your child is not on the waiting list for the Medicaid waiver programs in Texas, you need to do that preferably this week. And we're going to give you that information. Medicaid waivers are different than Medicaid insurance. And a lot of times that can be confusing to parents. I know it kind of delayed me from getting my child's name on the waiting list. And unfortunately in Texas, the waiting lists are very long, 15 to 20 years. So these are for long-term services, and they help you keep your child in your home and provide you with the help you need so your child can live in the home, stay in the community rather than in an institution. Some of you may have children that are already on a Medicaid waiver, because there are some for children that have a lot of medical needs. These waivers don't look at the parent's income, and they only look at the child's income. And most children don't have incomes. You don't want to put a lot of money or land or anything in your child's name. There are other ways to save for your children, like with a special needs trust, or an ABLE account, which we'll talk a little bit about that on Friday, I believe. Instead, they base the eligibility not on the parent's income and assets, but on the child's. And so it's different than the Medicaid insurance. Once your child does come to the top of the list for the waiver, they do get Medicaid. So a lot that can be confusing, because if you read the information about the Medicaid waivers, it says your child must be Medicaid eligible. Well, my son wasn't Medicaid eligible due to the family income. But when he came to the top of the waiver list, it doesn't have anything to do with that. They become Medicaid eligible with the waiver. They all have waiting lists. Get your name on all the lists that you think might apply. You don't have to do a whole lot. You don't have to think about it, except, make sure if you move or your phone number changes, you let them know. You don't want your child to fall off that list, because 15 years from now, if your child needs these services, you don't want to have to wait another 15 years. And if you don't need the services when his or her name comes to the top of the list, you just say no, thank you. So sign up today if possible. You can learn more and compare each program and all of these. I like this first site because it compares the different waivers side by side. Your child probably isn't going to qualify for all the waivers. So take a look, definitely get them on the waiting list for several waivers. I like the Navigate Life website. It has a lot of great information about the waivers. There's even some little videos that explains why you should get on the waiting list now. It's very parent friendly, easy to read. It's in English and Spanish. Is it in other languages, Judy?
Navigate Life Texas, yes, it's in like 26 different languages. Urdu, Hindi, Tagalog, however it's pronounced. You name it. It's in Navigate Life Texas uses Google Translate. So
Yeah,
basically
these
what
are,
you want to do is just call those two numbers.
yeah, call these numbers. HCS and Texas Home Living goes through your local IDD and mental health authority, which for Harris County is the Harris Center. Fort Bend is Texana. And if you need help finding that out, we can help you. The class waiver in, I believe, MDCP, the medically dependent children's waiver, is through Health and Human Services, and that's the number. And they'll just get your information and just stay up to date. They're supposed to call you every 2 years, but if they don't, you check in with them. Where am I at on the list? And here's a list of all the different waivers and how to get in touch with them. As you can see, there are many. And then questions.
And I know that we went over a lot of information, especially towards the end about the waivers. You'll be getting the slides. If your child is not on the interest list for a waiver, you need to make those 2 phone calls. You don't have to make any decisions now. Sadly, the wait list is 12 to 15 years long. I think for MDCP, for medically dependent children, the wait list is about maybe 3 to 4 years. That's the last I heard. So it's just really important that you get on that list, regardless of your income, because your child may need those long-term services and supports. Maybe they won't. But if they do, isn't it nice to know that they're on the list to get them?
Another thing too is if your child already has Medicaid, there are personal assistance services through Medicaid, and a lot of times your MCO or your Medicaid provider may not tell you about that. So definitely ask about that, because that can provide needed help to families when
While they're on that long wait list.
right, while you're on the waiting list.
And we're
Another
gonna-
thing too is if you get in crisis, there is a crisis diversion slot. So for instance, if the child's primary caregiver, something happens to them, there's many reasons. Just so you know, in case that happens, let us know and we'll let you know about the crisis diversion slot for the waivers.
And we're going to talk about some of this on Friday. The program that Leslie was talking about is called Community First Choice. And we're going to talk about that more on Friday. We didn't want to overwhelm you too much today. And we wanted to cover as much as we could in the hour. If you want to stop sharing your screen, Christina has graciously put the survey in the chat box. And we need to make sure that you all, regardless of whether or not you're a parent or ECI coordinator, please, please, please complete the survey. Questions?
I don't have a question. I actually used to work for a non-waiver, and I personally have a lot of experience with that because I have a brother with autism as well.
Oh,
So
great.
one thing I would recommend is getting them all on all of them.
Yep.
So what happens is, for example, my brother started with class, but it was a shorter period of waiting. So you can start him with that. Let's say in his case, he was with class first, then he came up for Texas Home Living. So, mom didn't want that. So we declined that and still we're on the waiting list for HCS. So you can still have them on all 3. And once you do make that decision to, let's say, the difference between them and just kind of see what's better for you and your family, then you're able to switch out the program and just go into that one program that you like. For sure, the benefits as well for those non-waivers is there is a service coordinator that comes with those programs. They usually try to to help you out and provide information, as you know, trying to kind of give you information of resources out there, help you with providers. So if you're clueless on what you need to be doing, service coordinators are there to be able to assist you with that.
That's great. That's great. Thank you. Thank you for really interjecting that, Ingrid, and we love the personal experience. Claudia asked, if you decline that moment for the Medicaid waiver, once it is your turn, do they keep you on the list? And the answer is no. So you would then have to, if you decline, you would then have to reapply. And then that 12 to 15 year wait list starts all over again. So I hope that answered your question. That was a great question. Thank you, Claudia. Other comments, questions?
I was going to say too, Judy, what happened with Cameron, he came up on the class waiver first. And so we accepted that. And then a few years later, he came up on HCS. And there are some differences in the waivers. And we declined we decided to stay on class. And we asked them to put his name back at the bottom, well, because that's the only place they will put it, of the HCS list, because years from now, we may choose to switch to HCS, but because we were using a lot of the specialized therapies that class has that HCS doesn't have, so you can do that. And that's kind of what Ingrid was saying too.
So Crystal asked a great question. Where can I go to sign up for other lists besides Medicaid waivers? So Crystal, those are the phone numbers you would call the local authority, which if you live in Harris County, it's the Harris Center. If you're in Conroe, it would be Tri-County Behavioral Health. If you're in Fort Bend, it would be Texana. And then you call that 877 number, which is in Austin, for the class program. Those are the lists that you sign up for. I'm not sure what other list you're thinking of that people can sign up for, but those are the waivers that people we know can sign up for. Was there something else you were thinking of, or did you mean Community First Choice?
No, I was looking for, my son is on the Medicaid waiver list, but I also wanted to find out what other lists I can put him on, or waiting list, to
Well,
get, other resources for support for him.
Sure. So we're going to talk more about that on Friday, but while you're waiting on that long list, there is a program called Community First Choice, and it is administered through your managed care provider, through your child's Medicaid managed care provider and the local authority, meaning if you live in Harris County, the Harris Center. So we're going to talk about that and how you can get those services. So all of the parents on this call and even the ECI coordinators, it's important that your child be evaluated by what we call the local authority. Why? Because when they go on that interest list, that wait list, they could be eligible for Community First Choice, which is supposed to be a program that helps provide in-home services and support in the community for your child. It's kind of a Band-Aid before your child's name comes up on the wait list. So Crystal, what county do you live in?
I'm sorry, what was your question?
Sure, what county do you live in?
I'm in Harris County.
So if your child has been seen by the Harris Center, and they may not have, and your ECI coordinator should know how to connect you, but if they don't, let me know, and I will email introduce you to someone who does intake at the Harris Center They will evaluate your child. Now, it is based on family income, and I don't want to get into too many personal details for your family. So maybe you can reach out to me afterward, but I'd love to help you to see if your child would qualify for community first choice.
Okay, thank you. I
Yeah,
appreciate that. I will.
absolutely. Absolutely. We need all the support and help we can get. So
And
yes,
Judy,
please reach out to me, Crystal. Yes, ma'am.
and I was going to say too, your local authorities like the Harris Center and Texana, they do have other services. I guess they're called general revenue services,
Right.
I believe.
Thank you.
Like there may be a way for you to get some respite care. Easter Seals is another good contact to check out their website too.
But that goes through the Harris Center as well.
Oh, do they? Okay,
Yeah,
is that
yeah,
how they do
that's-
their respite?
Yeah, that's how they do
Okay.
it now. Yeah. And we can talk about that on Friday. And Crystal, make sure you follow up with me. But the Harris Center or Texana, if you do have a service coordinator already, ask them about community first choice. And
Okay.
we'll be going over that as well on Friday.